Hello and welcome to Paget's Awareness Day 2022. I'm Dr Tori Herridge, an evolutionary biologist at the Natural History Museum in London and a friend and supporter of the Paget's Association. It's my great pleasure to welcome you all to this year's series of video interviews, where I'll be interviewing experts from across the globe to hear their unique perspectives on Paget's disease. For this episode, I will be talking with Dr Laëtitia Michou, who is a clinician based at the University Laval, Quebec in Canada. Welcome, Dr Michou.
Hi, nice to meet you.
Nice to meet you too, Dr Michou. Can we start with you introducing yourself and maybe telling us a bit about how you became involved in treating people with Paget's disease?
Yes, for sure. I am a French rheumatologist. I did all my medicine studies and training in France.
And you went to Canada?
Yes,
France to French-speaking Canada.
Yeah, so in 2007, I was invited to practice as a clinical scientist in Quebec City at University Laval. And I continue my journey on Paget's disease. So Paget's disease is my main research project in my research program still nowadays, because in Eastern Quebec, we have an hotspot of Paget's disease-borne cases. So it is closely related to the need of the population here in Quebec to have an expert on this topic.
Yeah, so how common is Paget's disease-borne in Canada then?
So in Canada, we do not have any epidemiological data. What we know is from a pan-Canadian study, which reported, so patients self-reported having Paget's disease is in about 0.3% of the population. But we know from discussion with rheumatologists and endocrinologists across Canada that Quebec is the highest prevalence area in Canada, because in the middle part of Canada, we have people originating from Eastern Europe, mostly Poland, and there is not so many cases there. So it is very rare in these provinces. And in British Columbia, almost the population comes from Asia, so they have never seen any cases of Paget's disease. In Quebec, we have recent epidemiological data from health insurance administrative database, so it is really accurate, and we have about 0.5% of the population. So it is a rather high prevalence in comparison to nowadays prevalence around the world.
That is very, very high, isn't it? Why is it so high in Quebec?
So in Quebec, we have some specificities. So we have historical specificities. So the French-Canadian population, nowadays about 6 million persons, descend from about 1,500 ancestors. So it is a very important founder effect that may influence the genetic component in the population. So it is one aspect. The other aspect is the size of the family. So maybe the difference with British, we came on just live here in Canada, is the size of family. When the French people arrived in New France in Canada, due to the religion, they have some influence to have a very large families and a large shipships, about 15 to 18 children per families. So when you have an autosomal dominant disorder with 50% of the ship having the disease, and you continue like this over a generation, you have a large amount of people carrying the mutation or carrying the autosomal dominant disorder, spreading across the population. So it may explain the specificities, and the French-speaking population coming in New France didn't get married with British population because of language. They were not able to open on the other population just to marry with other speaking population. So it just kind of isolates. So I think that it may influence the epidemiology of Paget's disease in Quebec.
So this is really interesting. But when were those 1,000 French immigrants arriving first in Quebec?
So first in Quebec, we have soldiers from Carignan-Salières in Soissons in France. and we have sprayers, and we have people working with fur. Almost all were men. And then in the second wave, the King Louis XIV sent boats with ladies to get married with the people in New France, and they were called the King's Daughters. And hundreds of ladies came and get married and have a huge quantity of children, and almost all French Canadians currently have at least one ancestor grandmother in the past who was a king's daughter. So it is very specific.
Is this the 19th century or the 18th century? Just so I can get
my head. Is 400 years ago.
400 years ago. Okay, yeah, there is a clear genetic factor at play here, but this is still only accounted for 50% of cases. So is there something else about Paget's in Quebec that can help us understand the broader causes of Paget's disease?
Yes, there is also environmental factors that may play a role. So we have worked on the smoke. So tobacco smoke may be a factor, and wood eating. So we determine that in our population that having been exposed to wood eating smoke during childhood in the Nordic way of life we have here in Quebec may have contributed, was associated with Paget's disease occurrence later in life. So maybe the component of smoke or heavy metals contained into smoke may be a determinant of Paget's disease in the future, maybe in interaction with the genetic predisposition too.
I mean, this is, when you talk about wood-fired heating as being a kind of a factor that was picked out in, I think one of the studies you did looked at many different potential environmental variables, and wood-fired heating was something that came out statistically as being important. So that, I think, what does that actually mean? I mean, should people be worried about their wood burning stove? Have you noticed that in terms of, because there must be a shift in habits amongst the Quebecois? I mean, presumably wood-fired heating has improved in quality, pollution levels have dropped, I'm guessing, smoking levels have changed. Have you also seen a corresponding drop in the prevalence and severity of Paget's?
Yes, we have seen a declining incidence of Paget's disease over the 8 last year in public administrative database. So it is really, it can be proved. And in the clinical phenotype, we also have a decrease in the severity. So the age of onset is delayed in time. The number of affected bone is lower than in the past. And we also have a less severe evolution of the disease. So we have the number of patients with bone deformity, bone fracture on a Pagetic bone has decreased significantly over time. And the need for surgery for Pagetic bone has decreased significantly over time too. So the evolution of the disease is toward a decrease in severity of the disease. And interestingly, the number of tobacco smokers has also decreased over time from 70% to less than 40%. So,
I mean, what is there anything unusual about the way that Paget's presents among Quebecois people? Is there anything unusual maybe that is tied to that particular mutation, or about the way of life in Quebec in the past?
The clinical presentation in Quebec is more time than in other countries. So we are currently we discover Paget for another purpose, and it is usually not symptomatic. But the specificity of Quebec is when you find a familial case of Paget, you find a huge number of affected individuals due to the large family size. So it is the specificity when you see a patient and there is a family history. You can see brothers and sisters, and you will find a lot of patients with unknown asymptomatic Paget's disease, even with already complication but not diagnosed as Paget's disease. So it is the specificity in Quebec.
Well, that is, I mean, and knowing that, I guess, is actually a very useful treatment tool. Well, thank you, Dr. Laëtitia Michou from the University Laval in Quebec. Thank you very much for talking to us about Paget's disease in Canada.
Oh, my pleasure.
And thank you all for joining us for Paget's Awareness Day 2022. Please be sure to check out the rest of our video series from the Paget Association's website. That's paget.org.uk. You can find interviews with clinicians from India, Brazil, Spain, and Italy, and more information about Paget's disease of the bone. Thank you for joining us, and thank you again, Dr. Michou.
Thank you.